I'm Dr. Marcia Sonity.
And I'm Dr. Caleb Moore.
And this is
the Free Smiles Podcast. Welcome back, Dr. Sonity.
Welcome back. We're back at it. Here we are.
Yeah, and we're back to share a lot of amazing things.
We did a lot this summer. We did a lot.
We did do a lot. I think one of the best things that we did was invest in our education.
As we do.
Which we seem to be doing quite often. And we took a trip to Banff.
Loved Banff. Shout out to the city of Banff. It was beautiful.
Yeah. So I really just wanted to talk about that experience today, what that was like for both of us, key takeaways. And I want to start by just talking about how we got there. Dr. Russ and Dr. Desi, they founded Stained Tooth Education, and they really wanted to bring hospitality and continuing education together and their love of wine. And I thought it was so well done. Yes. What were your thoughts about the weekend?
No, I thought the weekend was perfect. I think the setting, how they had us all at that just central location, everyone was staying, almost like a campus that we were staying at there. It was an art campus that we stayed at, which was just barely in a beautiful setting. You can't beat just the city of Banff and just how like picturesque and like how would you not want to be there. Every time they set everything up when it comes to breakfast, to lunches, to just the whole thing was just, I think, just perfectly done, to be honest. So
they actually partnered with Dr. Amanda and Dr. Adamo. And for those who don't know, I just want to share a little bit about Dr. Amanda. She is the co-creator of Impress Dental Courses. She's internationally recognized in the aesthetics continuum. She is a clinical instructor at the Coy Center, and she's a key opinion leader for many leading dental companies. And she was named top 25 women in dentistry in 2012 by the Dental Products Report. That's incredible.
Yes.
She really moved me in that CE, and we'll get to that later. But it was also hosted by Dr. Adamo. Dr. Adamo is co-founder, along with Dr. Amanda, of Impress Lecture Series. He's a graduate of State University of New York, and he has received honors in both removable and fixed prosthodontics. He's accredited by the American Academy of Cosmetic Dentistry, and he's the 80th person worldwide to achieve this honor. I know that I am probably missing a lot here.
Oh, yeah. I mean,
not even doing them justice for how talented they were.
Yeah. Well, it's interesting because when you say like what someone's achieved when it comes to like papers and certification, to me, that is one thing. That is a very important thing. But to see their work, to see what they do, to see how much just care and intention goes into everything that they do is just, I don't think you could speak about that. You get to see it.
You have to see it. And I love that word that you just used, intention. That has been the word of the year for me. I feel like it's just been my word this year. Doing everything with intention. And I felt like the way that they have a whole series of Impress courses, it's actually really impressive. The way that they did this course in Banff specifically, I think it was very intentional. And it touched on a lot of things that I felt like I could go back on Monday and implement.
Yep, and I did. I literally did a composite that next Tuesday, I think we got back, and the patient was super happy, and so.
Tell me about that. Tell me about it. Tell me what you learned. What did you take away from, the course overall, but the techniques that you're talking about that you implemented, and how beneficial was that for you coming back and then being able to say, hey, I can do this now?
Yeah, so I think so finding a system. To me, it's always about finding a system and what can I actually do, because I'm in a group practice. So to me, being in a group practice always means that me changing something means that I need to essentially change like 40 different things and make it easy for my assistants to be like, okay, what is she now wanting us to do that's different, because everything I do is different than the other doctors that I work with.
Yep.
So it was finding something simple. So when it comes to the composites, so I came back to my office, I pulled out my composites, and I said, I want to put them on a glass slab. I want to see what each of them look like at different thicknesses. I want to cure them and see what the palette is that I'm working with. Almost like how a painter has, I think of like Bob Ross when I'm doing this. Like I have this like slab of something and I'm just whatever, but it's smaller and it's like millimeters of composites. And just seeing the translucency, seeing the hues that are underneath them. So I did that the first day I got back. The patient that I was seeing, actually saw her for her new patient appointment probably a few weeks before the appointment. So I was able to take some photos that day, get an idea of where her kind of like shades and values were with those photos.
Mm-hmm.
So I knew she was like OM1. Like her shade of her teeth's like the brightest color imaginable. So I knew I had to add some opaquer and all that kind of stuff. So playing with the window technique is what they kind of went over when it comes to that composite, because we didn't have to break any contact. It was just replacing an old composite that she just was thinking. Actually, I lied. She originally had a composite on this tooth because
Okay.
of a developmental defect on the incisal edge of number 9.
Mm-hmm.
It had been there for years, started to stain, when she was like, a teenager until now she's in her 30s, 40s. Her current doctor that she saw before me had replaced it. She thought it looked really ugly. She said, I'm just not happy with this. It just really like just doesn't look good. And when I saw it, I not that I agreed that someone did poor work, but I
Right.
said, yes, we can improve this outcome. And she said, I was told I need a veneer. And I said, well, I don't agree. I think that we can just get a better result by doing composite, removing what's there and just
Mm-hmm.
playing with some of that shading and coloring. So we didn't have to break contact. So that's why the window technique was perfect. Natural tooth, just remove the composite that was there and then played with I don't even know what they called it in the lecture though. It was how you like create like the dentin kind of streaks first,
Yeah.
and then you put your opaquer over that, and then you put your like translucency over that to kind of bring out
Yep.
whatever that's called in the
Yeah.
window
So
technique.
with the window technique that, and I think what's great about this conversation right now is we don't have to be, as providers, we're so focused on systems, right? And doing things perfectly. But at the end of the day, it's what is going to work in our hands
Mhm.
and what makes sense for us and how we're going to implement it. Because if I don't understand the way somebody is teaching something, and then I try to go back and remember what it was, how applicable is that going to be? It's not. But it's finding a system that works for you specifically based on the foundation that they gave us, right?
Yep.
So when you talk about the window technique, I want you to explain a little bit about, from the beginning, like what does that prep design look like in terms of, I know it's going to vary depending on the tooth, how much restorative material is there. Are you taking away all of the restorative material that was previously there? What did that look like for you?
Yeah, I mean, I would say in most situations, even if I'm just replacing a composite on it, I am taking away the old material because I don't
Mm-hmm.
know what's underneath there. I don't know what kind of weird just shades or darkness is coming from the composite. I actually just did a composite this week too, where the composite itself was really dark underneath the enamel, and
Yeah.
that to me, just removing that and adding that just made the whole tooth shine just brighter. But we won't go into that. That's a different thing. But so essentially, the window technique is when you keep like you're not breaking your proximal contacts. I
Yeah.
mean, you can, I think, to a point, like there's a line angle
Yeah.
part of that, but you're essentially taking like almost like taking the front part of the tooth, just carving out that to the incisal edge based on where the composite is. The
Yeah.
composite that she had did wrap lingually just a little bit, but it's again, I'm methodically removing that composite. I'm not
Yeah.
just buzzing away. I'm like drying it, seeing if there's any, doing all those things to remove that very gently,
Mm-hmm.
and then seeing what the tooth looks like. So obviously we take photos before that. That's the hugest
Yeah.
thing, is taking pictures before you even talk to the patient that day. You take them before you get the patient numb. You want to know exactly what that tooth is before you dehydrate it. And the surrounding teeth to me was more important because I knew we didn't like that tooth,
Mm-hmm.
but the tooth next to it is what made that contrast stand out. We're talking about tooth number 9, the very
Yep.
front tooth to the left of the midline. Her number 8 was super bright, like had, I would say from cervical, just almost to the cervical third, she had like almost like demineralization, like white lines.
Yeah.
So a very white tooth.
I mean, I think about matching number 9 to number 8 or the vice versa. One tooth anterior dentistry as a whole, that's one of the hardest things we can do.
Yep.
Without any specific characterization, right? Those secondary, whether it's crazed lines and when you start adding those details in there, how are you going to match that, right? And it really depends on how invasive we want to be, right? How much room and depth we have in that window.
Mm-hmm.
And then what is the expectations from the patient?
Yes.
So when you brought her in And she's like, I hate this. I need a veneer. You know, it's not that we're promising her the world, but what did you tell her, you know?
Yes, so that's a great thing. So when I first had this conversation with her, I kind of went over what the process looks like. I said, we need to take off that old composite. I need to see what your tooth looks like underneath.
Yeah.
That first appointment is essentially the longest one. You are going to be numb. We're going to use this little barrier to cover your tooth up. So it's going to be a little bit, awkward or uncomfortable if you never had one of those used before, because we do want to use a rubber dam in these situations. So talked about that. I talked about doing a follow-up appointment. I said a couple days later, because we want to give the tooth at least 24 hours to 48 hours to rehydrate, to then check the shade that we chose and to check that everything as the tooth rehydrates is accurate. Because you can do things on that day to a point, but then when the tooth rehydrates, it's going to look just a little bit different. The brightness is going to be a little bit lower in value. And if I'm using that term right, it's funny because they discussed
brightness,
like
value,
hue
yes,
value and all
yes,
that stuff that day.
yes.
So to me, I said, hey, when you leave that day, the tooth is not going to look exactly how we plan it looking. It's going to look a little bit brighter. It might look a little bit like off, but slightly. But what I want you to look at is the shape of it and the texturing that I add to it.
Yeah.
I want you to see that and then go home and tell me what you don't like. And I scheduled a follow-up 2 days later, I believe it was. Yeah. So she knew that off the bat. She knew before anything happened that it wasn't going to be perfect that day and that we were going to play with some things a couple days later. When I saw her for the appointment, I kind of reiterated that. I said, we're going to take whatever. We're going to take some photos first before I even start talking, did all that stuff. And then that was really it. I mean, I don't think she was pretty, as far as like, she was very pleased on day one, which always is a good sign. But I personally am actually going to see her back again for a little bit of a redo.
Yeah.
Because I think it's so funny because, like, to me, now number 9 matches the rest of the teeth really nicely, but 8 is just so white. Yeah. Like, it's so, like, the brightness of that and the opacity is more, because I didn't want to put too much, because you almost feel like if you put too much opaquer, then you're going to make the tooth look too bright. Then you're going to be like, oh God, now I got to remove, like, removing that is more annoying to me than I think adding. So to me, I'm just going to add more of that and then do the same layer on top.
But how great is it that the patient that you have is so, number one, pleased with the work, right? Because I think selection of patients, just like they select us, we have to select them.
Yep.
So, it's really cool to have that relationship with her, to be like, hey, can we play with this a little bit? Like, can I match this?
And you ask permission for that. You're not just like telling someone. You say, hey, this is where we're going to start. If it's okay with you, I know you're happy with it, but I think I did something else with her, and I saw her after that. Maybe it was a crown prep or something like that. And I saw her for that appointment. I was like, hey, like, how do you feel about the tooth? Yeah. In the back of my mind, I'm like, please let me do more of this. And then she was like, yeah, like, I kind of see what you're saying, but like, I'm still, she's still happy with it, more like ecstatic over with the previous result. But she was like, yeah, like, I'm okay with you, doing something, adding whatever that is that you think you want to add to it, essentially trusting me to do that.
What's really cool about that, though, is just patients signing up for being a part of the journey, right? Like, when we tell them, we love what we do, we're artists, like, we care so much, like, we're going to Canada to invest in courses that are allowing us to do this technique to help you, and they're like, yeah, let's redo it, or let's try something new, and I love when patients are just willing to have those open and vulnerable conversations, because that's what makes this fun.
Yeah, exactly. Because I mean, you have to start with square one. You have to start with, like, you want to have, the only way you learn more, and this is something that Amanda said as well, that thing is practice. It doesn't mean that you have to practice on people. Obviously, you get those skills over time with like different things you see. Yeah. But even like, I started collecting old models on my practice, and I'm going to start like just playing with different texturing and things like that. Like, if I have downtime, just kind of trying to perfect that. Because I feel like after that course and just doing a few things since then, I really have found a new joy in doing composites, because I have a roadmap. I think things, you lose joy in them in dentistry when you feel like you're a little stuck, or you feel like, I'm just not getting the result that I want, but why am I not getting that result? But if you can kind of navigate that and have a roadmap to, hey, I can try this and this next time, and then get a better result, then you get excited. Then you get excited for that end result.
Yeah.
But it takes time.
And your patients get excited
Mm-hmm.
too. I think, you know, some of the difficulties in what we do now is that there's been a huge shift in the last, 15 years. Now our patient population is almost dictating, what they want, right? They see on videos online, like, I want these prepless veneers, or, I want composite bonding. And so they're coming in with these high expectations, expecting us to be able to do this without understanding that we're the ones who are looking at all of your data, looking at the blueprint, right? And figuring out the best options based on science and what we're learning.
Yep.
And so, what I loved about the course in Banff was that they gave us a roadmap essentially of, we're not forced to do porcelain, right? A lot of people want to do veneers on everybody, and a lot of patients want veneers, but because they don't understand that, as providers, we can do really good composite dentistry. And if you master that first, then you're going to carry those techniques along into veneers as well.
I think that was a huge part of that, like a take home from that course. Because also I feel like I have a lot of patients that come in and they want cosmetic dentistry, but they're mortified by some of that stuff that they see on the internet of like people having their teeth shaved down to chiclets. They have these little tiny nubs and like whatever that like horror, things that people post about them going to some veneer clinic that, there's some that are coming out that aren't even board certified dentists doing this stuff, which is crazy. But they come in, they're like, I don't even want to talk about veneers because I'm just thinking, they're just in their mind thinking, I'm just going to have my teeth shaved down. And I love just the injection molding techniques that I've learned, coming back to like this kind of composites, adding those characteristics. Not everyone wants that, but it's good to have that understanding, because if you understand it like how it translates into porcelain, all of those characteristics are the same, and you have to be able to know those things to communicate with your lab of what's in that person's natural tooth that you're trying to replicate.
Exactly. And I think that all of the foundations that we learned, that Dr. Amanda and Adamo were talking to us about, it's like not all of us in dentistry have the joy of, we're going to set aside 4 hours to do this class 4 restoration. That's just not the reality. You have a busy schedule, and we have patients that we're trying to see. How do you take this composite dentistry to the next level of being really efficient and making the patient really happy, right? And so what I loved about Impress in general was that they gave us quick and easy ways to do it. Match the enamel, match the dentin, layer it this way, polish it up, have the patient come back for a follow-up, and make sure that things look really good.
Yep.
And so I that was huge for me. Is like, how is this going to be applicable to, the people who are coming here to spend money to learn how to do these things? How are they going to be able to take it back to their community? Which I thought was amazing.
Yeah, no, it was a great course. I have looked into, obviously, every time I take a course, I want to take like 20 after that. But obviously, budgeting the
and making
CE courses is my kryptonite.
And making right, because we would just spend so much money on CE.
I would spend my entire
never ending learning, or just and it's really cool because I think that's what makes dentistry fun, and it makes it. I never wake up thinking like I know it all, or man, this is really boring, because there's something new every day coming out. And when you surround yourself with people who are learning new things or have just different ways of doing things, it really makes a difference. For me, I've been a photographer for a very long time, and coming into dental photography, there's so much that I didn't know when I was coming into that. And so that's another course that Dr. Amanda and Adamo talk about, is they're really big into photography, and she actually wrote a book about that as well. Overall, it was a great course. There was a lot of applicable tips and tricks, and I don't know, I can't speak highly enough about it. So
no, I really can't. I mean, they're great technicians and great dentists, but they're also just great people. I think that makes learning from someone, I mean, not that you have to like everyone that you learn from, but I think it helps to see someone's journey, how they got there. Because for us, it's like we're kind of in that beginning stage of just the tip of the iceberg of where we're going. And I feel like when you see where someone started, you feel like that's an actual like attainable thing, even if you don't get to their what's the word, expertise. Like, I don't know if I'll ever be as good as they are at what they do, but I'm still going to try to be better than I am every single day, you know?
Yeah. I can't even remember the specifics on this quote or question, but I think it was Tom Brady. Somebody had asked Tom Brady, for your being who you are, for your kids, do you want them to try to be the best, or do you want them to be their best, right? And what I thought was so powerful about his answer was he said, I want my kids to be their best, and their best may be the best, right? Or maybe better than the best. So when we talk about, trying to achieve these goals, I think it's really cool that you just spend every day trying to be your best. And who knows, because your best one day may be the new best, right? If anyone is interested in learning more about Impress, they have an amazing website with overview of all of their courses.
Yep.
Same thing with Stained Tooth Dental Education. They have really cool courses coming up in Champaign. They're going back to Banff,
Yeah.
which will be incredible. So take a look at their websites, and we will see you guys next week.
Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.